Hey, how are you? I missed you guys last week. Welcome to this week's edition of the Dr. Kre and Me show. We're going to talk tonight about 5 signs that you need to be screened for colon cancer. As many of you may or may not know, March is Colon Cancer Awareness Month. So I wanted to just come in. Hey, Tanya. I know I've given you some tips for colon cancer in the past, but I wanted to make sure to bring it up during this time of the year when it is time for colon cancer awareness. Everybody has a month. Of course, last month we talked about heart disease and the Go Red movement. And thank you so much for Keisha. Hey, Dave and Denise, how y'all doing? I missed you guys. Last time we couldn't do it live from my professional page. I had problems sharing the speaker. We had a guest speaker last week. Her name was Keisha. And Keisha was telling us about her experience with heart disease. So we talked about February being Go Red month. Hey, Dr. Eva, Reverend Eva, how you doing? Thanks for tuning in. Hey, Carmela, how are you? This week we're going to talk about 5 signs that you need to be screened for colon cancer. And we're doing that because it is Colon Cancer Awareness Month. March is. So, hey Ava, how are you? How are you? Thank you for tuning in. And when you get in, just say, hey, Miss Keith, I just was talking about you. I was just saying how we appreciated you coming in. We didn't have it last week, but we had it the week before. And we appreciate you giving your testimony and telling your story of how heart disease is so important and it's something that we need to be so aware of. Really appreciate that. We had a lot of good feedback from that video and how people were thankful that you shared, and also that made them more aware that, you don't have to be old to get heart disease. So thank you for coming in. We got Illinois here. We have, I don't know what state you in today, Keisha, but usually Georgia. Birmingham representing. So thank you. So, hey Trina. So we're going to get started. You know who I am. I'm Dr. Kre. I'm your board certified family medicine physician, but I specialize in what's important to you. So through my videos, my telemedicine, my awesome family medicine practice here in Birmingham, Alabama, I help you learn how to live healthier, happier lives. I feel like when you know better, you can do better. And I want to empower you to take the knowledge that you get today and every week that I'm on and take it to your own primary care doctor and say, hey, I was wondering about this. Did you check me for this? So all of these things I want you to be aware of so that you can get the best help ever. Sure, God is good. Hey, Doris. Doris is coming in from Indiana. All right. So number 1, the most obvious one is blood in your stool. So 5 signs that you could need to be screened for colon cancer, because March is Colon Cancer Awareness Month. Number 1, somebody type that in the chat for me, is blood in your stool. So let's talk about blood in our stool. We're gonna be kind of graphic tonight because I want you to know what's like concerning blood and what's like, oh my gosh, blood. So if you have ever had any problems with hemorrhoids or anything of that nature, you may wipe and you'll see like a little bit of blood. You look in the water, there's no blood there. The water's white. That's all, like, okay, let me take note of that. So bright red blood in your stool could likely be a sign of hemorrhoids, a tear if you strain too hard. So make sure that we're kind of watching that. If it's dark red, it means that it is coming from upper in your tract. Not my heart, y'all. I'm short. So the higher up the blood is, it has to work its way, more room and more time to work its way through your digestive tract, so the blood gets darker. So if it's darker blood, then you will see the darker blood. You may not see it on your tissue. This blood you probably won't see in your tissue because it's had time to mix and mingle with your stool. So your stool actually now looks dark or tarry. Have you heard people describe their stool like that? Tarry stool, dark charcoal stool. Those are all different. So if it's usually hemorrhoids, you don't really even see anything mixed in with the blood. You may see a little bit of specks in the toilet. But if you look back there and there's no clear water, it's all pink or bright red, then we have a problem. That is an emergency. So if you're bleeding and it's dripping and it's coming out and you can see it grossly, then you may need to go to the ER if it's after hours. Call your regular doctor. But for the most part, that's to get to the emergency room because you're actively having what we call a GI bleed. Now, GI bleed could be caused by several different things. But the big one that's the most concerning, hey, Miss Banks, how you doing? The big one that we're concerned about is colon cancer. That's a big one. And as a lot of you guys know, a lot of people are being diagnosed with colon cancer younger and younger, and they're dying from it. The age of getting screened for colon cancer per your insurance company, and actually per all of the task force, the U.S. Preventative Task Force and colon, the GI Association, they all say 50 years old for colonoscopy, which is this test that you do where you drink all that stuff the day before, you go to the bathroom profusely, get cleaned out so they can look in. They're looking for polyps, they're looking for masses, and they're trying to get from one end of your colon, which your rectum is the bottom end of your colon, all the way to the other side near your appendix. So if they get all the way over there, they're very confident. So, but the bad thing is that now 50 is really not what it used to be. So usually 50 years old, people, you know, if you were getting screened then, hey Lisa, how you doing? If you're getting screened by then, back in the day, that was sufficient. But you're going to have to start watching your body, watching for your symptoms, because you know what? People are getting diagnosed earlier. I know someone was telling me this week they knew of someone that's 40 years old diagnosed with stage 4 colon cancer. 40. And if you don't have any family history of colon cancer, you're not going out there looking. Hey, Dr. Kathleen, you're not going out there looking to see about if you have should get a colonoscopy or not, because that's not really on your radar. You're 35 years old or you're 40 years old. So I'll back. So number 1, if you have blood in your stool. Number 2, if you have a family history of colon cancer. Hey, Miss Glenda, how are you doing? Miss Glenda was giving me her testimony about her life. So she has an awesome story to share. Anyway, so number 2, if you have a family history of colon cancer. Hey, Dr. Pam, family history of colon cancer, you need to be screened probably 10 years before your family member had the diagnosis of colon cancer. So if your dad was 40 years old, and that means you need to have your first colonoscopy at 30. So if your parent was 75 when they got it, you still get it at 50 years old, unless you're having some of these symptoms that we're going to talk about. So it's either 50 years old per insurance recommendations, or before if you have some of these symptoms. So be very mindful that you have to pay attention to your body. As we learned last time, that you are your best advocate. If you're not going in there saying, I'm telling you something is wrong, I'm telling you something is different, then a lot of times you're young. You're not 50, 60, 70, you don't look like you should have cancer. But nowadays, it's no look that cancer should have, right? We know people dying left and right from cancer. So number 1, blood in your stool. Number 2, family history of colon cancer. This needs to say immediate family. So parents, grandparents, siblings. Those are the people that you want to know. How old were they when they had their diagnosis? And then get a little bit of a story. I know a lot of times in the Black community, we don't tell each other what our family history is. Like, we know grandmama died, she had cancer in her stomach. Well, where at in her stomach? These are things that if you have living parents and living relatives, you need to be asking these kind of questions. A lot of you guys may not know. Hey, Pam, Zoe was born with 1 kidney. Well, I could just have 1 kidney. Jay could have 1 kidney. You know, we don't know. It's not anything you go looking for. But once we found out that she was just born with 1, we started picking up the phone, calling everybody, saying, does anybody else just have 1 kidney? Is this something that's hereditary, or was this something that was totally incidental? In the midst of that, we got to learn a lot about our family on both sides, things that we may not have known, to just kind of be mindful of. Okay, everybody's anemic, so that's something that we need to be mindful of. Now, she's anemic, bless her heart. So a lot of things you just have to, if you don't ask, a lot of times they won't tell. So make sure to ask. So 1, if there's blood in your stool, that is concerning that you could have colon cancer. 2, if you have a family history, you really need to be watching for those signs, these signs and symptoms. And you need to have your colonoscopy 10 years. That's 10. Somebody write that in the chat. Get your colonoscopy 10 years before your family member was diagnosed with colon cancer, especially if they were younger than 50 years old. Number 3, changes in the way your stools look. Hey, Zenobia, changes in the way your stools look. So what, don't try to act like you're not out there looking at your stools when you get up from the toilet. You know that you're looking at it. Like, okay, it was different. It was darker. It was lighter. People come here telling me all kind of things. My stool looked different, doc. It looked like, arm or whatever. You're just like, what in the world of all the things and ways to describe it? That's what you want to describe it as? So make sure that you're looking back there. And so that you can know this is normal for me, this is regular for me, or this is not normal, this is not regular. So a really interesting sign of colon cancer could be that your stool becomes like pencil shaped. So you have a really foreign piece of stool, it narrows into pencil shape and then goes back into normal. So it's kind of like that. Who's being my note taker? Somebody right in there, get your colonoscopy 10 years. Hey, Miranda, 10 years prior to your family member. Thank you, Dr. Pam. So if you got form stool here, and really thin stool in the middle, that could mean, hey Maggie, how you doing? That could actually mean that you have a mass here, and that stool is trying to get by there. So it narrows. So you got some good solid form stool, then you got a little string, and then after you get past the mass, yeah, if you see pencil shaped stool, normal pencil, normal. Kind of like if you have sausage links. You have a link of sausage and you had a little part where they connect, and then another link of sausage. Now nobody's gonna be eating sausage, right? But you get the visual. I need y'all to get this visual because people are dying from this disease. Every single day, they may be seeing the symptoms and just have no clue that these are actually symptoms. So when you know better, we do better, right? Shaped stools are not good. No, they're not good. So number 1, blood in our stool. Number 2, family history of colon cancer. Number 3, changes in the way your stool looks. That can even be if it's white. Now, if they was black, your stools used to be dark and brown. Now all of a sudden they white and look like clay. That's a problem. Something is going on in your belly. Okay. Dr. Pam says sausage links shaped stools are good. Yes. Hey, Arlinda. Yes, we do need this information. It's killing people left and right, y'all. It's really, it's serious. So blood in your stools, family history of colon cancer, 3 changes in the way your stool looks. Hey, Shantae. Number 4, anemia. So we were just talking about that. My husband's anemic. Zoe's anemic. My mother-in-law, everybody anemic. However, if we didn't have that picture and all of a sudden my husband shows up and is anemic, I'm concerned. Because one of the telltale signs of colon cancer is iron deficiency anemia. Because you're losing a little bit. Hey, Miss Diane, you're losing a little bit of blood in your stool, and it may not be dark enough that you can tell. Or your stool dark anyway, and you don't think it's anything different. But you could be just losing a little bit in your little bit of blood every time you go. And if you're going, a couple of times a day, and you're doing it every day, 7 days, that adds up. So your blood count can be low. So usually in school, we had a saying that anyone with iron deficiency anemia over the age of 65 or so was colon cancer until proven otherwise. So I'm like, prove to me that it's not colon cancer. So we're going to check your iron. Okay, we're going to check, the rest of your tests. We're going to ask you how you've been eating. Are you eating enough green vegetables and taking in the right nutrients for your iron levels to be up? So these are things that when I'm getting all these labs, if you come to me or your doctor's getting all these labs, these are the things that we're checking off your list. And you came in January and your number was 1 point. And then 3 months later, and it's dropped to 3 points. We have to get to the bottom of the answers. Let's take a quick commercial break and talk about insurance now. A lot of times, insurance does not want to pay for things. But we don't have to because you got these, or you don't want to pay for them because you got these huge deductibles. But be mindful that to get to that $6,000 is one thing. That's a lot cheaper than your family having to pay for a funeral because you're being stubborn and not wanting to pay for this test or that test because of the insurance is what it is. So a lot of times they may not want to pay for a colonoscopy. I'm having my colonoscopy later this year. I'm 36. I'm much younger than 50, but I'm having it. I'm having it done, and I've just seen it happen too many times, and we're like, oh my gosh, why is this happening to our people, to anybody? It's not just race specific. It's just like any young person is getting it. So I'm gonna be an advocate now. If I'm paying for that for the next 7 years of my life, I just be paying for that colonoscopy. But I'm gonna know if I got a problem or not. I'm gonna know it before I'm 50 years old. So, like we said, 1, blood in your stool. 2, family history of colon cancer. 3, changes in your stool, like pencil thin in places. 4, iron deficiency anemia. So make sure that usually at least once, twice a year that you're getting an anemia assessment when you go to the doctor. Every time you go, the doctor isn't drawing an iron level on you because you may not have anything that warrants getting an iron level. So be clear, this isn't one of those things that you're going to go there and be like, okay, what was my last iron level? They may not have checked it last year, but we just need to have some baselines in place. So, if I get one January last year, we get one November this year, and things are looking pretty stable, and here comes 2020, and it drops 3 points, but you're not having a cycle, you're not having any reason to be bleeding, then that's an issue. So just be mindful that anemia, especially the older you are, we need to know why you're losing your iron, because you're not menstruating, you don't see yourself bleeding. Do you have a little bleeding ulcer? Or do you have a polyp here that's leaking and bleeding? Do you have a mass? So these are all things to be mindful of. And number 5, unexplained weight loss. In this society, there are a few things that can cause you to have unexplained weight loss. And of course, as you know, cancer is one of those things. So be very, 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 very mindful that if you eat like a hog and you're just losing weight, it could be a sign that you need to be checked out for some things. Now, insurance will not pay for you to have scan from head to toe to make sure you don't have cancer. That's not possible. Now, if you smoke, if you have a smoking history or you smoke, there are some tests that we can rule out colon cancer. If you got a cervix still, we can rule out cervical cancer with the pap smear. Colonoscopy, we can rule out colon cancer. So there are some things that we can do, but it's not like you can they won't pay for a PET scan, which is a scan that you look all over to see if you got cancer anywhere. So just be mindful that we have to be our own advocate. If you're not out here doing Atkins or intermittent fasting or eating like a bird and the weight is just falling off and you don't look healthy, then be mindful that we need to be checking for colon cancer. Remember, 1, blood in your stool. 2, family history of colon cancer. 3, changes in the way your stool looks. 4, anemia, especially iron deficiency anemia. And 5, unexplained weight losses are all signs that you probably should get screened for colon cancer. Now, what other ways can we get screened for colon cancer other than the dreaded colonoscopy? So there are a couple other tests out there, but the colonoscopy is the one true, definite, and as of now, it is the gold standard for ruling out colon cancer, right? So you go in about 3 o'clock the day before. I think you wake up that morning, you start drinking your clears. 3 o'clock, you're drinking some, you take the gas eggs and you take the gas eggs and you do the Miralax and start drinking the Miralax and Gatorade. And you drink it, a bunch of it. And you do stool softeners, I think. So then you start to clean yourself out. So hopefully by the next morning, you've cleaned out magnificently, because you do not want to get in there and be shamed and they be like, Dr. Pam wasn't clean when she had her colonoscopy. We're going to have to do this again. You don't want to have to drink that stuff but one time. Follow directions and do what the people say do, so you can be cleaned out when it's time to go and look. Okay? That's very, very, very important. So colonoscopies can be repeated depending. If you have polyps, then you may have to get them repeated every year or every 3 years or every 5 years. They'll take the polyp. Now, polyp is a little bit of growth that's growing in your be clean, yes. it's a little bitty growth that's growing inside of your colon. So the colonoscopy is looking into your large intestine. For those of you who don't remember the science, the large intestine goes up your rectum. So they put the light up there. It goes straight up, over, and down, and it stops right there where the appendix is. That's what's called the cecum. So then they bag their way out and make sure they didn't miss anything. Come on back down and out. If they find any little growths, any little masses, they go in, take it, a piece of it, burn the little spot back so that it doesn't cause you to continue to bleed, or freeze the spot, but usually they burn it. And then they send that off to the lab to say, hey, we found a little growth in the colon. Is it precancerous? Is it cancerous? Or is it just benign? And within a week or two, you know, hey, I had 15 polyps, and all of them were precancerous, or all of them were benign. I don't have to go back for 3 years. Or if it runs in your family, plus you have polyps, then you may need to get it every 3 years. If you get in there and you're so squeaky clean, they see that there is no polyps, no anything, you're good for 10 years. So usually that's the gold standard, 10 years. Now I'm sure you see on TV the Cologuard. The Cologuard is a test where they use like immuno DNA, RNA to check and see if you have any traits of having a colon cancer. Well, this test is supposed to be very sensitive, and it lasts about 3 years. It is good for 3 years. Hey, Sharika, the test is good for 3 years if it's negative, right? If it's positive, you still got to do a colonoscopy. So everybody's insurance doesn't pay for it. Most of the Medicare plans do pay for it, but flat out regular Blue Cross, regular United Healthcare, they don't pay, you know, just a lot of them don't pay for it. However, the prep is much worse than the procedure. Yes, because you're knocked out. Oh, yeah, I didn't say that. They give you something to make you sleepy. You think you're knocked out, but you're alert enough to turn over and move over and do what they tell you to do. But they give you the medicine where you don't even remember that you were doing what they asked you, you know, what they told you to do. So you're really groggy. I usually recommend doing a procedure on a Thursday, so you can be off Friday, Saturday. You're not going to be driving the next day. You're going to be just relaxing and easing back into your diet. So back to the Cologuard. So Cologuard is a green form. Is that Zoe? Zoe. Don't call me. I'm sorry, y'all. Zoe, I'm not finished. So Cologuard, here comes Zoe. Is a green, it's green and it's got a white sign. So the white sign allows you can remember that. You'll see the commercials on TV. But it's very expensive. So the Cologuard is for, tell everybody, hey Zoe. Say hey y'all. So Cologuard is you've done good for 20 minutes. So anyway, the Cologuard is good for 3 years. But if your Cologuard is positive, you still gonna have to have that colonoscopy. So if you're like, I don't want to send that box back, I don't want to have a colonoscopy, there is a test. Dave said, hey, tell Mr. Dave hi. That Miranda. No, she at her house. So then there's also what's called the fecal occult blood test. I can do it in the office, but that Miss Pam say hey. So the fecal occult blood test you do once a year. You go in, the doctor does the rectal exam. We know before you leave that that you actually have a negative test, but that has to be done every single year. So yes, there are other tests other than, hey Carolyn, yes, there are other tests other than the colonoscopy, but the colonoscopy is a gold standard. You know, you're either going to have to repeat the others more frequently, or you're going to have to, good job. Or you'll have to repeat them more frequently. So you may as well know that you know. And then accompany with these symptoms. So let's, come on, count down for me. Count down 5 fingers. Let's tell them the 5 ways or things to be mindful of. 5. No, you got to start with 5. 5 things to be mindful of that you may need to be screened for colonoscopy. So 1. 5 is blood in your stool. 4. Do not 4. 4 is family history of colon cancer. 3 is, that PJ, Uncle PJ. 3 is changing stools if you see any pencils. That's bad. 2 is iron deficiency anemia. And then 1 is unexplained weight loss. Now, this March is Colon Cancer Awareness Month. This month means so much to me because, as a lot of you guys know, and some of you don't know, one of my very best friends died from colon cancer last January. So she had stage 4 colon cancer. She was diagnosed in May of 1 year and she died January the next. Now, you're not talking about somebody that was not physically fit, that was not healthy. It did not run in her family. She started to feel sick a couple of weeks prior. You know, it was like, I don't feel good. Thought that she was pregnant. Thought that she was pregnant, but the tumor was actually secreting a pregnancy hormone. Such a sucky tumor. Such a bad thing for the tumor to do. So we're thinking that she's pregnant, and come to find out that PJ is Tanya's husband. So come to find out that she wasn't pregnant. She goes in, they do the testing, and it's already gone to her liver. So the exclamation that I get when she calls me, she's like, I know you're going to fuss at me, Kre. I know you're going to fuss, but I promised that I was taking care of myself. Hey, Dr. Lucci. And I was like, girl, I know I'm always fussing, but I wasn't going to fuss at you. So sure enough, it had already gone to her liver. And it was such an aggressive... Hold on. Yeah, they're speaking to you. They're telling you hi. So it was such an aggressive disease. She had the KRAS mutation for you medical people out there. No one in her family had colon cancer. It snuck up on her. She was doing fine. You know, she was doing fine prior to this. Thought she was pregnant. Had nausea, vomiting, unexplained weight loss. Had her labs drawn in the fall of the year before. And her labs were normal. Came back in May. Repeated her labs later. She was iron deficient. Her liver enzymes were all over the place. It is serious. Tanya was 36 years old. She was a ER physician. She was a wife. She was a mother. She wasn't a mother yet. She was a wife. They didn't have any kids. She was a wife. She was an awesome friend. So I promised to take on the awareness of colon cancer and making sure that everyone knows that it's so important. Talk about Auntie Tanya. Making sure that everybody knows that you need to be screened, because she was 36. She had no time to know, no time to react, no time to have these things checked out. Hey, Chris. Yes, Dr. Lucci, 36. So, just make sure to pay attention to yourselves. Make sure to not miss anything, and make sure to love on your loved ones a little bit harder. When people are complaining about things, don't just push it on the rug, especially when thank you, I don't need my hair comb. Especially when they are healthy at baseline. Just know that it's important. So that's my spiel on why it's why it's so important to be screened for colon cancer, because my friend died from it. And I wish I could say, had she known better, she could have, reacted fast. But she reacted as fast as she could. She got diagnosed in May. We was starting chemo in June. By January of last year, because we just made 1 year. On Zoe's birthday, she died. So, yes, on your birthday. So we just ask that you guys pay a lot of attention to yourselves. I mean, that's a friend. She was my line sister too, my best line sister. And so it's hard. But I commit to telling everybody about it so that we can help people do better. So I'm not going to leave y'all on the bad. Hey, Gert. Thank you for that. I'm not going to leave you guys on a low note. So we're going to make sure that we get the word out for Tanya's sake. And that's what she wants us to do. That's what she wants us to do, to spread the word, to spread the love, okay? And in very exciting news, I'm going to be on ABC 3340 on Tuesday, March 20th. So check my mommy out on TV. Hey, Dr. Jared. I'm going to be on there Tuesday, March 20th at 9 a.m. on the Talk of Alabama, where we're going to talk about my book, best-selling book, 10 Commandments of the Working Wife. And I can't wait to tell everyone about it. So I hope you guys tune in on Monday if you can, or record it. Yes, Dr. Eva. So we're so excited about that. And I'm just doing a lot. I'm doing a lot because Say we can. It's my job to educate. If I don't do it, then who will? That's your birthday? Yes, Dave. We're going to party. Hey, yes. Happy early birthday. So, okay, guys, you know who I am. I'm Dr. Kre. I'm your board-certified family medicine physician. You see, I'm a wife. I'm a mom. I'm a working mom. Okay? And you see, Zoe has joined us. Oh, yes, and the Rump Shaker colon cancer walk is March 24th. So we all need to try and be there for that. Glenda is a survivor as well. So, ABC 3340. So I am a wife, a mommy, a doctor. Yes, and this is Dr. Kre and Me. Thank you for joining. I help you learn to live the best, healthiest, happiest, wholest life that you can. Okay? So I feel like when you know better, you can do better. So I hope you guys tune in on March 20th at 9 a.m. to Talk of Alabama, where I'll be talking about my book. And it's going to be fun. I'm so excited. I'm so excited. And if you've not gotten your book, get your copy at www.workingwifebook.com. And it's 10 Commandments of the Working Wife. I will see you next Monday. We'll talk about something good. I'll see what else March is about. Anyway, talk to you guys soon. Hey, Michelle. Talk to you guys soon. Love you. Bye.